It's very common for us to get the question from individuals that are aging into Medicare that have TriCare for life, or maybe they also have veterans benefits if they're a veteran. Do I also need Medicare? How does this all work? Well, in this video, I'm going to explain to you exactly if you need Medicare. I'm going to answer the question in both of those situations, and I'm also going to explain exactly how Medicare works in that particular situation, whether you have TriCare for Life or whether you have VA benefits. My name is Christian Brindle. I'm the owner and operator of Everything Senior Insurance, formerly known as Christian Brindle Insurance Services. And in this video today, we're going to talk about TriCare for Life and veterans benefits. So let's first start with TriCare for Life, because I believe, amazingly enough, that it is the simpler of the two. So when you first turn 65 and get onto Medicare, you get what's known as Medicare Parts A and B, also known as Original Medicare, okay? Everything that comes with Medicare circles around what's known as Original Medicare. Now, this is Medicare that comes from the government, right? Everything else you hear about when it comes to different parts of Medicare, Part D, Part C, is actually insurance company provided products, okay, to fill in the holes of things that Medicare does not provide, or Medigap or Medicare supplement. But original Medicare Parts A and B come from the government. So Medicare Part A covers what's known as hospitalization, and Part B covers medical. There's a whole complexity of what those two things cover in and of itself, but if you just remember those two things and just understand they fit like two pieces of a puzzle that work together to give you medical benefits, you're typically going to be all right. Now, original Medicare alone only covers typically about 80% of medical items, okay? And it leaves behind an unlimited 20% that you are responsible for as the beneficiary, right? And Medicare does not have any maximum out-of-pocket limit or stop loss. This is very important to know because most insurances have a maximum out-of-pocket or a limit that you are responsible for before they step in and take over 100% of your bills. Medicare, unlike most insurances, does not have that. So you have a 20% unlimited out-of-pocket that you can be responsible for. That being said, Medicare also is very one-dimensional coverage when all you have is original Medicare. It does not cover things like dental, vision, hearing, or prescription drug coverage. So typically people get Medicare supplements or Medicare Advantage plans to pair with their Medicare through private insurance companies in order to fill in those holes and fill in those gaps. Now, if you have TriCare for Life, let's answer the first question: do you need Medicare? Well, the short answer to that is yes, you do if you have TriCare for Life. Typically, TriCare is not TriCare for Life until you reach age 65 and get onto Medicare, and then it becomes TriCare for Life. But typically, TriCare for Life will require you to get Medicare A and B in order for them to keep you covered under your TriCare. Most people don't know this, but it's very common for TriCare to actually send you a letter if they have indication that maybe you're not enrolled into original Medicare when you're approaching maybe a few months away from your 65th birthday. And TriCare for Life becomes a secondary to Medicare in that situation automatically. So Medicare is your primary and TriCare is your secondary. And if you do not pick up original Medicare, TriCare for Life will not be able to cover you anymore. So it's almost like, yeah, you do have to get it. Now, Medicare is your primary, TriCare is your secondary. It works as an 80-20 split between the two. Medicare pays about 80% of your medical bills. TriCare picks up the remaining 20%. And between the two, as long as it's a Medicare covered charge, meaning most things that are medically necessary, things like surgeries, doctor's office appointments, things like that, you're going to have full medical coverage, again, as long as it's a Medicare covered charge. TriCare for Life also provides you with prescription coverage. Typically, they're going to run that through and administer it through an insurance company called Express Scripts, but that comes included with your TriCare for Life benefits. So that by itself really does provide you a lot of coverage, fantastic coverage at that, and you typically do not need anything else. Now, you do have the option, if you want to, when you have TriCare for Life, to go the route of pairing your Medicare with a Medicare Advantage plan and running your Medicare through a private insurance company. The reason why someone might do this is because when you get a Medicare Advantage plan, the Advantage plan becomes your primary, TriCare is then your secondary, and they still will coordinate benefits. And as long as the provider you're going to is in network for the insurance company that provides your Medicare Advantage coverage, you're typically going to have no copays, no deductibles, no out-of-pocket. So you don't lose anything coverage-wise, but you can get additional benefits that you don't have access to with original Medicare, such as dental, vision, hearing. There are a lot of Medicare Advantage plans that are built for this specific type of situation that will lower your Medicare Part B premium. In 2025, Medicare Part B does have an $185 standard premium that everybody pays unless you're in a very high tax bracket to which they charge you more, or if you're in a very low tax bracket such as like a food stamps tax bracket to which they can have the state pay for your Medicare premiums for you. But outside of that, everybody typically pays the same $185 a month for their Medicare Part B premium. Well, there's certain types of Medicare Advantage plans that are built for this specific situation that you can pair with your Medicare, and they will actually lower your Medicare Part B premium for you depending on where you might live. They might do it by $50, $60, $70 a month, maybe $100 a month. Maybe in some areas they might even do as much as $150 a month. But the plan in and of itself is going to be a $0 monthly premium. Let's say it lowers your Medicare Part B premium by $100 a month. Well, it's saving you $1,200 a year on your Medicare Part B premium, and you're not paying anything for it. You have the same coverage that you would have had with original Medicare, plus usually some additional add-ons as well. So that's a way that we see a lot of individuals, when they get explained their options, end up going when they have TriCare for Life. A Medicare Advantage plan is the primary, TriCare for Life is the secondary. It's definitely not a bad way to go whatsoever, and we have a lot of clients that have used it in all different circumstances and had great results when it's picked correctly, okay? Now let's talk about veterans benefits. So veterans benefits works a little bit differently because there can be different types of veterans benefits depending on your situation. You might have regular veterans benefits. You might have VA disability benefits to where you have a certain percentage of disability that you have status with the VA. You might have what's known as CHAMP VA. These are all different from each other. And to simplify it, I'm going to give you a very oversimplification of all three of them. So regular veterans benefits typically means you have access to go to a nearby VA hospital to you. Some areas might have several different locations you can visit a VA hospital. Others might just have one. But whatever the case might be, in your state or in your area, you have the access to utilize the VA hospitals. And typically, you're not going to pay anything to get service there. But that being said, for most things, there are some exceptions. You typically are going to have to get your care at the VA hospitals or their facilities. You don't have a ton of options to use outside private facilities. Now, VA disability benefits works a little bit differently. You have a lot more options in terms of going to private hospitals and institutions. Typically, you're even provided some extra benefits that you don't always get with VA benefits, such as dental, vision, and hearing. And usually it's the strongest coverage you can get of the three. CHAMP VA, on the other hand, is usually when your spouse is a veteran and you get CHAMP VA, which is essentially the same thing almost as TRICARE for Life. Extremely similar coverage. It acts as a secondary to Medicare. And when you have CHAMP VA that you're eligible for, you do have to get Medicare. Now with VA disability or regular veterans benefits, you don't have to necessarily get Medicare. You do get prescription coverage through the VA if you get your prescriptions through the VA. But it is typically recommended to get Medicare because it opens up more options for you to go to private institutions and private hospitals if you were so inclined to do so. So it just provides more options for you. A lot of times when you just have regular VA benefits, you're very pigeonholed into using the VA system. Now some areas have great VA systems where the care is fantastic and people are very satisfied with what they get. Other areas they might feel like the quality of care is not all it's cracked up to be, or maybe they feel like they just want the option to be able to go there when they want to. But if they have something more serious, maybe they want to go to a world-class private institution. Having Medicare gives you the option to do that. So the short answer is you don't necessarily have to get Medicare. Doesn't mean you won't get penalized. You will get a late enrollment penalty if you do not take Medicare at 65 for every reason, unless you are working and have credible coverage through your employer. We've done plenty of videos on the channel about that as well. But there are some people that feel like they're good enough with VA benefits and they can go their entire life without ever having to get on Medicare. And I'm not going to say that that's impossible, but it's not what my office typically would recommend. We feel like you're best off when you're a veteran no matter what your situation is, by having Medicare, even if it's only just Medicare. A lot of times with different options, whether you have Champ VA or original VA benefits, getting a Medicare Advantage plan similar to TriCare for Life is not a bad idea, because you can get additional benefits and get access to those additional benefits and have your Medicare Part B premium lowered in some cases, in some areas, depending on where you might live. Now, with original VA benefits, Medicare works very separately. There's very few things that they're going to work together to pay on. It's almost like the VA covers you at the VA facilities and Medicare will cover you at the private institutions. It's almost like they don't touch each other. They don't have much to do with each other. With Champ VA, when your spouse is a veteran and you get Champ VA for being their spouse, Medicare's primary, the Champ VA is secondary, just like TriCare for Life. And VA disability, typically when you go to private institutions, they will coordinate on the benefits. So they're all very different and unique of each other in terms of how that works, but understanding which one you have and what coverage you have will allow you to make the most informed decision. And I hope this video helped you do that. If you found this video helpful and it answered your questions, please do us a favor. Smash the like button for the YouTube algorithm. It's going to help more people like you who are TriCare for Life members or veterans and that are also aging in for Medicare understand their options in a real way. We're licensed in 45 states, so if you find yourself turning 65 and maybe you're a veteran or maybe you have TriCare for Life and you really just want a personalized recommendation based on your specific situation, we offer that at no cost and no obligation. Again, we're licensed in 45 states, so most of the areas in the country we can help you with. Make sure to reach out to us today, and one of our licensed agents and amazing team members, by the way, can do a free consultation with you, take a look at your situation, and see if a Medicare Advantage plan might make more sense for you based on what's available in your area, or if maybe you should just stick with original Medicare. It's going to depend on what's available where you are. Reach out to us today. 801-255-5340 is our office number. Again, that's 801-255-5340. We are Everything Senior Insurance, formerly known as Christian Brindle Insurance Services. I'm Christian Brindle. Hope you enjoyed this video, and happy Medicaring, everybody.